Welcome to the Charity Matters podcast. Mr. Rogers' mother said, always look for the helpers. I'm Heidi Johnson, nonprofit founder, lifelong helper, and your host. I've been interviewing the helpers for a decade with my blog, and I'm so excited to finally be sharing these inspiring conversations with our new podcast. Join me as we learn the challenges and stories of innovators, entrepreneurs, and modern-day heroes who set out to solve the problems of humanity. Today, our guest is Rabih and I, the CEO of Project Hope. I'm excited to share his amazing journey and our inspirational conversation. Good morning.
Hi, good morning.
Good morning. How are you, Rabih? How are you? It's nice to meet you.
Nice to meet you too, Heidi. How are you doing?
I'm fantastic. Thanks so much for joining me.
Thank goodness for people like you who want to focus on the good things that are happening in our world instead of the negative. I mean, I'll tell you one thing. We stopped watching the news at home for the past 2 weeks because we've had enough.
Yeah.
And there's a lot of good going on, and I'm glad, I'm grateful to you that actually you want to focus on what's going on in the world, the good stuff that's going on in the world.
The good stuff, and there's just so much more good. Maybe I'm an eternal optimist, but even for me, being an eternal optimist, it's challenging right now. There's too many negative messages, so we're going to change all that today, and we're going to talk about the good stuff. So I know what Project Hope does, but why don't you share a little bit about what Project Hope does in the kind of day-to-day, exactly what you guys are doing and how you're solving the world's problems. Lots of them.
Solving the world's problems. I mean, we play our role in making people's lives a bit better. As you probably know, Project Hope's been around since 1958, so we're a little bit over 60 years old. And our focus has been mainly on training health workers. Because we believe that the solution is in the hands of the healthcare workers working all over the world, especially the first responders.
Right.
So when you go to any disaster area or when you go to places in Africa and you see who's actually carrying the load, it's the healthcare workers. So we focus quite a bit on doing that through different interventions. Disaster response is one of them, whether it's a hurricane or an earthquake, or as we're seeing now with the COVID-19 as well, we have doctors and nurses that are deploying, that are helping other doctors and nurses, that are training them. We're sending supplies, we're supporting them. We're empowering those first responders on the ground to do a better job as much as possible.
Wow.
We also focus on infectious diseases, whether that's HIV, tuberculosis, or again, COVID-19 as well.
Right.
And we work at the community level because at the end of the day, the communities have to own the problem. And our role is not to solve the problem for them. Our role is actually to support them and empower them because they have the solutions. A lot of the places where we work, they have the solutions. They just need support.
Right.
And this is one of our approaches that we really take pride in terms of empowering and supporting those communities to solve those problems.
And has that always been the strategy of Project Hope? Has that always been their methodology? Has it always been community-based from the very beginning? Or is that...
It has been right from the beginning. You know, Project Hope is a people-to-people foundation, right? It's people to people. Right. That's how we connect. And it has always been the community. It has always been the doctors and nurses on the ground. And for us, the last thing we want to do is replace them. Our job is to support them. And working at the community level, working at the clinic level, the hospital level, we go and ask them, what do you need? What kind of support do you need? How can we help you? And that's how we come in and help them, whether it's infectious disease or chronic diseases and maternal and child health, especially the newborn health, which is a major focus for us. That's what makes us different, and that's what makes us special.
That's beautiful. So, Rabih, you don't just wake up and walk into a job like this. You don't. It's just not kind of where you start. There is a path, and there's a story with what triggered this in you to want to do this work. So I'd love to hear a little bit of your journey to this point, because I'm sure it's fascinating. I read a little bit about it, but I don't want to have a spoiler alert for everybody else. But
well, I mean, I wish I could say I planned it all. All right, I look very smart if I said I planned it all, but I didn't. I'm a civil engineer by background, so I have no health education, no health background, and I grew up in Lebanon during the Civil War. And after the Civil War ended, I ended up going to Sierra Leone in West Africa. Initially, the plan was to go for 2 weeks, and I ended up, stretching that to 9 years. And it was the longest 2 weeks.
A little sense of time, but
Hey, 2 weeks, 2 years, 9 years. And it was during the Civil War. And I was still doing construction work with my civil engineering background. And there was a cholera outbreak on an island. And somebody asked me if I would volunteer for their organization and represent them for a couple of weeks until they send a team in. And it was at the time of the cholera outbreak. So I said, sure, I'll help out, although I have no idea what I'm going to be doing because, again, I'm not a health person.
Right.
And I ended up going to that island. We took a hand-dock canoe with an outboard engine. It took us 4 hours in a rough sea. We made it to the island. It's not as bad as I make it sound. It's fun. But we made it to the island. And there are always those triggers that change people's lives. And I'm sure, something like that happened to you as well for you to focus on what we're doing and what you're doing now. And I got to the island, and it's an island of about 10,000 people. Very poor. They had one clinic and one nurse in that clinic. So I walked into the clinic, and people were dying from the cholera outbreak.
Oh my gosh.
And when I walked into the clinic had no roof, no windows. And frankly, the nurse was actually sleeping. He was drunk and sleeping.
Wow.
And as I was walking in, there was a kid sitting at the door of the clinic with his mom. He looked very sick, but I didn't know, what was the case. So I walked in and I spoke to the nurse, and I asked him, I said, people are dying. What are you doing? You're sleeping and you could smell alcohol. And he looked at me and said, I have no medicines. I have no medical supplies. I have no support. All I'm doing is seeing people die. What do you want me to do?
Wow.
And for me, that was a wake-up call. And as I was walking out,
I have chills everywhere. You just gave me the chills.
This is 1999, and I still get chills anytime I talk about it.
Wow. Well, I have them.
And as I was walking out, that baby was dead, the one that I saw at the entrance. So I went back to the capital, and I said, we have to do something. With a little bit of money that I had, we bought some medicines, we bought some IV fluids, we bought some chlorine, and that's where I used my engineering background to start chlorinating the water and making it clean, and went back to that island. And from when we went there the first time, there were about 100 people dying every day. Within a week, it went down to 2 people, and within 10 days, there were no more dead.
Oh, my God.
And it showed me what a little smart investment could make in terms of the impact on people's lives. So and I never looked back. That was 1999, and I started doing this work, and it's been amazing.
Well, I think that it's also can be a little bit of an addiction, right? Once you get this hook, you can't. Yeah, you can't stop, because no matter, and my husband's like, you'd be better if you were a shopaholic, Heidi. Like, it gets into your soul, and you are determined to help more and more people. That's just always, there's never enough. The needs of humanity are greater than we can solve. There's never enough hours in the day, but we are always pushing our own numbers, limits, goals, all of that. So with all that being said, what do you think your biggest challenges are? Project Hope tackles an enormous humanitarian effort, and the challenges have got to be on the same scale. But what do you think they are? What's one that keeps you up at night? What keeps you up?
There are many challenges, but I think one of the biggest challenges is getting people to know what's going on in the world. You and I started this conversation talking about the bad news, and that's all we hear.
Right.
And when people hear only bad news, they don't react to the good news that's going on.
Right.
So one of our challenges is to bring what we're doing in the field, whether it's in Africa, in Asia, in Latin America, or here in the U.S., to people so they would know that there's a lot of good still happening and that they can actually contribute to that. They can do they can participate in some of that good.
Right.
To really bring what we're doing in the field to people's minds, to people's eyes, so they can see it and feel that they can actually contribute to a good cause instead of, dwelling in the negativity that we're dwelling in these days.
Well, and I think also people feel so helpless. We have 1.7 million nonprofits in the United States. People don't know where to start. They don't know. They don't have an emotional connection necessarily. They don't see the boots on the ground work of what it takes to do what you do. I really think that it's those emotional connections that get us fired up, that get us to get in a canoe and go, 10 miles and bring chlorine. I mean, those are the things, like what's going to call us to action? What is going to get us out of our chair and make us feel like we're doing something rather than just sitting here and hearing the bad news. And we need to start becoming a planet of action, right? Not that we're not, but we can all do a little bit more.
I think we can all do a little bit more, but also sometimes we look at the problems around the world and it's overwhelming. And we think, what can I do about it?
Right.
My $1, $5, $100 is going to make any difference.
Right.
With the huge problems that we're facing. And reality is everything counts. Every single penny counts. Every single thought and action counts. Even for people that cannot donate, if they, spread the word about what Project Hope is doing, about the needs. And it's not about us. It's about the people that we're helping, right? It's about the women and the children that we're serving. If people can spread the word or donate or volunteer, all of that has a huge impact. And I mean, for us, we're privileged, right? Even though we're going through what we're going through in the U.S. with COVID cases and everything else that's going on, but we're still privileged. We can still go to a clinic. We can still go to a hospital. We can buy food.
We have a roof.
Water.
We have food. We have clothes, right? We have safety.
And for people that we serve, people in the communities that we serve, whether that's in Namibia or Malawi or Ethiopia or Indonesia, we represent much more than healthcare providers. We show them that the world cares about them. Right. So we represent that hope that people need, because at the end of the day, if people have hope, they can survive to the next day with the hope that something good is going to come.
Right.
And that's what we do. So partnering with our donors, whether they're the $1 donor or the $100,000 donor, is actually what enables us to provide people with healthcare and hope and hopefully a brighter future.
I love that. So I always say that, the bucket is heavy, and Alyssa's heard this too. The bucket's heavy. At the end of the day, when you're at the end of the chain, the bucket is yours and you have the responsibility. It's not like you're running a widget factory and you have to make so many widgets. You have human beings that are relying on you for life and death situations, for food, for medicine, for everything. And when that bucket's heavy and you just think, there isn't another minute in the day, how am I going to do this? What fuels you? What fuels you to take that next step with that heavy bucket?
Oh, goodness. I mean, our job is all about people, right? And it's about the team that we have. First of all, the first lesson I learned when I took this job is a smart CEO will always surround himself or herself with smarter people. And that's
Amen.
what I've done.
Right.
So we have an amazing team. And it's not just the team here at headquarters, our teams in the field. When you see them working day and night and weekends and during storms and COVID, and all they're doing is trying to get that medicine to that last clinic that they can get it to, I mean, that energizes you. And when you see a kid that was, dying, and a month later you see that kid thriving, it pushes you to actually take that extra step and make an extra effort to make sure that you continue to see those. And, people say, okay, what keeps you going? I mean, it's that human resilience that we underestimate. The human resilience is amazing. Whether it's the people that I saw in Beirut when I went and visited after the blast in Beirut, or in Sierra Leone or Iraq or Afghanistan, people's resilience is what makes us work harder. When you see them that they've got nothing, but they still have a smile on their face and they're pushing forward. They're trying to make ends meet. They're still trying to provide their kids the same way we want to provide for our kids, put them through schools, make sure they're not sick. I mean, when you see that, how can you give up? How can you sit back and say, okay, I've done enough? You can't.
No, you can't. And that goes back to the addiction, right? Because there's just always more people to help. There's always more need. I mean, when are those, I don't think anyone ever in a nonprofit role ever says, my work is done, or I've made a difference here, or look what I've just done. I've never interviewed anyone that has said, oh, yeah, I did this, ever. But we are all in a privileged position to witness grace and kindness and generosity and the resilience of the human spirit in these moments. I mean, what are those moments where you just kind of stop and say, you just mentioned that you were, there after the blast in the Middle East. What are those moments where you just say, I can't believe that I have a small hand in whatever this is? And it's not about us, but somehow you realize those moments of grace, that you're in a privileged position to be and witness these things. What are those? What is that moment? What are those things that come to mind?
Wow. I mean, a lot come to mind. First of all, is how privileged we are to be where we are, as people living in the right zip code, living in the right country where we don't have to deal with that all the time. Second thing is just, people think that we're actually helping others when it's very reciprocal. When you go to a place like Beirut during the blast and you see the youth who came from all over the country to help clean up the streets, help pick up the pieces, volunteer, donate money, donate medicines, donate food. And they've got nothing themselves, but they brought whatever they can to help. I mean, how can you not fall in love with people like that are actually doing? And it gives you an unbelievable sense of, humility.
Right.
That, we're here to help, but people just need a helping hand. They don't need, they don't need a handout. Nobody wants a handout.
No.
And people need a helping hand. People need to be able to help each other and help themselves with pride and with dignity.
Right.
And to be in a position where you could actually help them achieve that is just amazing. It doesn't get better than that.
I don't think it does. I mean, I always say we don't get into this work for money. That's never the motivation. But we get paid in different ways, and those are our paydays. And those paydays are so much bigger and so much more meaningful. And it's just why we do this, right? It's why we do this. Because we're blessed. I always say I have a front row seat to humanity, and if I ever write a book, that will be the title. And I think
let me write it down so I could feel.
I'm watching out because you have a book in you for sure. My goodness, with the stories, I can't even imagine the stories that you can tell. Well, one of the things I have a love-hate relationship. We've talked about all the things we love about our work, but one of the things that I personally struggle with is it's a word that is a love-hate word for me, that we use all the time, which is impact. We have to, and I get being accountable to our donors, and I get having a good ROI, and I get that we need to measure our work and push ourselves harder and set goals and all those things. And that's all fine. But when you're measuring a moment of bringing chlorine and water and saving, going from 120 deaths a day to 2 to 0, how do you even measure that, right? And so people always want to know, well, what's the impact? And so I always ask the question, but I ask it in a way, and asking what the impact of Project Hope is. I don't care if it's a number. I don't care if people served. I want to know what you think it is that how you are impactful. Because to me, the stories and the heart and the soul is where the impact is, not in the measurement tools, but I guess we have to do a little bit of both. So
yeah, I mean, it's a fair question, and you're right. How can you put a price on somebody's life? How can you monetize that? How can you say, oh,
right.
this life is worth $2, this life is worth $100,000?
Right.
And you start looking at that. But that being said, it is a fair question because donors want to make sure that their money is going to the right people and that
right.
you're maximizing the impact of that money and
right.
money is not being wasted. And for us, it's critical. We take that very seriously. I mean, we work hard for every single cent that we get from our donors, and we appreciate every single cent because every cent counts and it saves people's lives.
Right.
And one of the most impactful things that we do is actually training. Now, think about the multiplying factor of training of doctors. If you go in as a doctor and treat 10 patients, that's fantastic. You've just saved 10 patients. But if you go in as a doctor or as a nurse and you treat 5 patients and you train one doctor who in turn will actually every day treat 50 to 100 patients, look at the impact of your money. And potentially those doctors and nurses will train other doctors and nurses. So the multiplier effect is the biggest return on investment that anybody could ever have, especially when it comes to healthcare workers. And for us, that's why everything we do, whether it's during a disaster response or a regular, program that deals with maternal and child health or tuberculosis or HIV or diabetes, training of healthcare workers is critical because that is the one thing that we leave behind. You can build a clinic, it could get destroyed.
Right.
You can provide medicines and medical supplies, they'll get used and they run out. But when you train people, that knowledge stays behind. And it's a permanent knowledge. And for us, that is the most impactful work that any organization can ever do.
Amen. I agree with that. I run a youth leadership organization, and what we do is we train the trainers. That's what I do for our college kids, teach leadership to our high school kids, and our high school kids teach leadership to our middle school kids. Yeah. And it's a waterfall, and we serve 3,500 kids a year, and we have 2 employees. We are the scrappiest nonprofit known to man, but we train the trainers, and the waterfall continues, right? It just keeps flowing down, and I think that model it's a good one. It's a brilliant one. So if you could dream any dream for Project Hope, any dream, what would that be?
I mean, there's a big dream that I don't think it's going to be achieved in my lifetime, and I hope it does, which is that Project Hope and other organizations like Project Hope are no longer needed. Mm-hmm. Because that means the world is in a much better place. Right. Now, more realistic and immediate dream for Project Hope is that we really reach more people that are in need. Right. I mean, when you ask about what keeps me up at night, obviously the safety of our staff. The next disaster that's coming, can we actually respond? Can we get the resources to respond to those disasters? Can we actually make sure that we deliver, trainings and we deliver services during COVID-19 when there are quarantines, etc.
Right.
But the one thing that always keeps me up at night is who we could have reached that we didn't. Who could we have changed, their life and we couldn't. So this is why we always try, one more, there's a Gatorade ad and I'm not advertising for Gatorade, but they always say one more time. They're lifting weights one more minute, one more time.
Right.
For us, it's one more try. Go a little bit, that extra step. And people do not understand how that extra step makes an unbelievable difference. Because if we take that extra step, and somebody else takes an extra step, before we know it, we've gone a mile.
Right.
And for us, those are the people that we want to reach, people that we could have reached, but we didn't. And my dream is to be able to reach those. Now, listen, I'm not idealistic. I am very realistic. We know that we cannot save the world. We cannot do
You're an engineer, so by nature you have to be realistic. It has to come with the DNA somewhere.
Of course, otherwise my friends would have wasted all their money. We have to do it together. One organization cannot do it on its own. Even the NGO community, with the 1,700 or 17,000 or 1.7 million, they cannot do it on their own. It has to be a partnership between organizations, grassroots organizations that are on the ground, the host governments where we work in, governments here, in the U.S. and the West, corporations who play a critical role. And sometimes they don't understand the critical role it could play in terms of supporting organizations, but also creating opportunities for people to find a job as well. So it has to be a partnership between private, public, individual donors who who would send $5 a month because that's all they could afford.
Right.
So we're all in this together. And one organization alone cannot do it, or a group of organizations cannot do it.
So let's say we're all here to serve one another. That's why we're here. That's the role. We're all here to serve one another. So, Rabih, I can't even begin because, again, the scope of what you do is so huge, and I'm already thinking about your book, but what life lessons that you have learned, since 1999 when you got in that boat and went to that island, to now, the lessons that you've learned from in that time, in the past 21 years, you've seen incredible things and been a part of incredible things. So what are those big life lessons?
I don't know if they're big life lessons. I know they were impactful life lessons when it comes to me. As an engineer, you want certainty about everything you do, right? You want, you want to know everything before you make any decision.
And you couldn't have picked a more uncertain.
And that's not life. Life is uncertainty.
Right.
And for me, one of the most important things that I've learned, especially stepping away from my engineering world, is taking risks. Take a chance on people. Take a chance on people's resilience. Take a risk. Do something that your gut tells you it's the right thing to do, and your brains tell you, no, it's not. Listen to your gut instincts much more than you listen to your brains all the time. And taking a chance on people and believing in people's goodness goes a long, long way.
I completely agree with that. And I think it also breeds more goodness. When you see it in them, it sparks it, and the ripple effect continues.
Yeah.
Go ahead.
No, please go ahead.
I was going to say, but how do you think you've changed since in those 21 years? How have you changed?
Well, I've become much older with a gray beard, all of that. But I changed in a way where I do believe in the power and the impact of individuals. I'm a changed person, a completely changed person, from focusing on my company and making money, which, I got rid of, and I funded the first projects that I did in the humanitarian world, to really focusing on how can we improve as a society. It's no longer about me. It's no longer about my family. It's always now about the entire society. How can we help each other? And, having grown up in Lebanon during the Civil War, I didn't know that was in me, because you grow up in a war and you always want somebody to help you. You always want somebody to stop the bombing. You always want somebody to make sure that you get food. And that was in me the whole time, and I had no idea. And suddenly, it came back out, and I was like, okay, it's about people. It's about that extra step. So for me, the one thing I changed is, the fact that I can never get enough. I never stop. Whatever I can do, I want to do a little bit more. Some people think I'm crazy. Some people think I'm a workaholic. I just love it. And the second thing is, I love my job. I'm telling you, doing 7 years of engineering, I hated every second of it.
Don't tell your parents that.
My dad could never understand why I switched jobs. But I love what I'm doing. And there's nothing better in this world than actually loving the job that you do. Because it's no longer a job. It's a passion.
Right. Completely. And the job of helping other people, I mean, like I said earlier, it's the best payday ever. I mean, it's just, there's something so satisfying and rewarding in knowing that somehow, in some tiny way, that you made another life better, and however that is. There's something miraculous about that.
That's right. And you know what it is? Is that they actually made your life better too.
100%. That's why we're addicted.
Exactly. They made your life better. And that relationship with people that you've never met,
right.
But you know you helped somebody and they helped you back.
Right.
That is the addiction itself.
It is. It's completely the addiction. And that's why this work is so beautiful and so inspiring. This work is so hard. Anyone who does this work, it is so hard because we go to bed at night thinking about the people who's, are on our back. Literally, we think of the people that we're serving, our organizations are serving. And I don't think people realize how hard it is to have a business that relies on the kindness and generosity of others. It's an innately flawed business model in so many ways. It just is not the ideal business model. But yet we somehow make it work, and everyone continues to step up and do this. And so it's just such a privilege to be able to hear these stories and share your journey and inspire other people with the incredible work that you and the whole team at Project Hope are doing. I mean, just truly amazing. And I think sometimes with big nonprofits, people feel a lack of intimacy. There's a disconnect because they think, oh, you're so huge, you're international, you're so big. But it's no different, right? It's just people helping people and doing a great job. So I'm so grateful that you've shared your time, and I'm so grateful for all that you're doing, and your stories are amazing. Tell me where and how we can support you. I know you have an event coming up, but where can we donate? Where can we send money? Where can we volunteer? How can we help?
I mean, first of all, thank you. Thank you for taking the time to talk to me. And I mean, we are a family. Project Hope, what makes us special is that we're a family. We know each other very well. We're comfortable with each other. There's no ego. We're all in this together. We're all in this to help, the next person. Right. And I'm forever grateful for Project Hope to give me this opportunity to actually work for such an organization. It's just my dream come true. In terms of help, go to projecthope.org. Look at our program, see what we're doing, look at the impact. And there you can volunteer. You can put in your application for volunteer. You can donate. Spread the word. Spread the word about the work that we're doing, about people's needs, about the resilience of people that we serve. Because at the end of the day, it's all about them. It's not about us. So thank you again, Heidi. This is really fantastic. I mean, I'll wait for your book. I'm sure your book is going to come out before a month. But
I don't know.
Spreading the word about our work.
Well, it's a privilege, and it really is. And I just love learning these journeys and these stories, and you just talk about the ripple effect. You talk about doctors and the legacy that they leave, but think of the legacy that you've left and Project Hope has left, and the ripple effect of the millions of lives that you've impacted. And I hope you sleep well tonight thinking about that and not about all the others. I hope you think about all those lives you've changed and impacted and made better. And I know you've made mine better today. It's just been such a privilege to talk to you, and I'm really grateful. So thank you so much.
Thank you so much, Heidi. I really enjoyed this conversation.
Thank you for listening to this week's episode of the Charity Matters podcast. I really enjoyed talking to Rabih Torbay today about what it takes to run an enormous nonprofit humanitarian relief agency that changes people's lives. I think his comment about the resilience of the human spirit and the ability to smile amongst so much loss was so inspiring and true. To learn more about these modern day heroes and entrepreneurs, or if you just like to reach out to us, visit us at charity-matters.com or connect with us on Instagram at Charity Matters. If you enjoyed our conversation, we'd love it if you shared this with your friends and family, because together we can make a difference, one small act of kindness at a time.